everyone, and welcome. We have all heard by now in the news that many of the patients who are infected with the novel coronavirus that causes the COVID-19 disease end up going to the hospital, and a lot of them end up in the ICU on a ventilator breathing support as they recover. In some cases, they are having to spend a lot of time on the ventilator, maybe about 10 days or even 20 days. The longer they are on the ventilator, the higher is the risk to them of secondary complications like pneumonia. But not only that, turns out that they also find it more difficult to come off of the ventilator. And it happens because their diaphragm that helps them breathe naturally gets kind of lazy, and it forgets its function because the ventilator is providing the mechanical support for breathing. Recently, FDA has authorized a device that can help with that condition. I presented one of these devices in a video. You can find that on my channel. It's called the Trans-Ares system. But in this video, I'm going to talk about a second device that was authorized by the FDA a day or two after the Trans-Ares device came out. So I'm going to give an overview of this device and give you a few points of how it differs from the Trans-Ares device, but both are designed to accomplish the same purpose and the same goal. So let's look into that for a quick overview. This device is called the Lungpacer Diaphragm Pacing Therapy System, and it was authorized by the FDA on April 14, 2020 to help treat the COVID-19 patients during this emergency. Before I go into some details of this device and the conditions of the authorization, I want us to take a quick look at a video animation just as a quick demo to understand the nature of the problem.
The breathing muscle, known as the diaphragm, is controlled by electrical signals sent from the brain through the phrenic nerves. The diaphragm contracts to create a negative pressure, which expands the lungs to draw in air through the nose and mouth, then relaxes again to push the air out of the lungs. In certain medical situations where breathing is assisted with a mechanical ventilator, air is forced into the lungs under the machine's positive pressure rather than being drawn in naturally by the diaphragm. The diaphragm may become lazy or partially inactive when the mechanical ventilator is doing most of the work. Research shows that ICU patients requiring mechanical ventilation often experience diaphragm muscle shrinkage within 18 to 69 hours, leading to a condition known as ventilator-induced diaphragmatic dysfunction, or.
So as this video talks about this condition
VIDD,
known as ventilator-induced diaphragm dysfunction, it is quite common and not well known to the common public. So that is why when I heard about this, I was really excited to learn more and understand what is going on. So it's very good news that FDA has authorized some of these devices to help the patients recover faster, get off the ventilator much quicker than they would otherwise. It helps both the patients and the hospital who is potentially running out of ventilators as number of patients with COVID-19 show up to their door. So this particular product is manufactured by Lungpacer Medical Inc., a Vancouver, Canada-based company. It's an investigational product only at this point of time. It includes a control unit and a live catheter that is inserted surgically and attached to the phrenic nerves. And the idea is to stimulate the phrenic nerves on an ongoing basis or intermittently while the patient is on the ventilator so that it stimulates the diaphragm. The scope of the EUA is limited to only COVID-19 patients on mechanical ventilator. It is to assist in weaning off patients off of ventilators, but not to be used for more than 30 days. There are many risks, include arrhythmia, bleeding, diaphragm injury, embolism, perforation, puncture, etc. Many risks included with this device, and you can find them in the IFU that has been posted on FDA's website. FDA is requiring the manufacturer to have a process in place for reporting adverse events, and that will be very important in this case. Some of the implications are that it's an investigational device, so the benefit risks are still not well known. The concept works, the technology works, but we still need to see in the real world what kind of data we can gather, and are there any other side issues or safety issues that we should be worried about. They have done some feasibility clinical studies. 78% of difficult to wean patients, according to their criteria, were successfully weaned, but it's very small sample size. So there's a larger clinical study going on right now across 26 sites, 300 patients, in a randomized parallel assignment of clinical trial. Patients are being recruited. Some data is coming out, but still not a whole lot of information available. So like any other device, this has risks. And under the current circumstances, FDA has determined that the benefit risk is still favorable for it to be used so that we can help COVID-19 patients who are put on the ventilator get off the ventilator quickly and avoid secondary complications, reduce the number of days that they're on the ventilator so the supply problems are not that bad. So this is a good news. Now, I mentioned the Trans-ARS device that was also recently authorized. In that case, the electrodes are directly inserted and in contact with the diaphragm for continuous ongoing stimulation. In this particular case, it may be intermittent or it may be for a limited period of time. So there are differences, but they are both trying to accomplish the same goal. This is great news for patients, great news for hospitals, and great news for doctors, because now we have two options. They can be used for this particular purpose and accomplish the goal that they are trying to set forth for them. So this is another example of many different emergency use authorizations being issued by the FDA at a rapid pace. It's a breakthrough pace. I've never seen this before. And the difficulty is to keep track of all these developments. What I'm doing is making videos like this as a resource for you. So I encourage you to sign up on my YouTube channel. You can go there. Here is the YouTube channel. You can go and sign up to receive notifications. What I try to do is gather information from multiple sources and synthesize it in a way that's easily processed, so you don't have to look up too many different sources of information. I have made several videos already, and they're all on my YouTube channel. You can also follow me on LinkedIn, and there when I post these type of videos, I provide a link that you can use to directly go to my videos. If you have any questions or comments about the COVID-19 crisis that we are having, or you would like me to look up different topics of interest to you, let me know in your comments, and I will research those topics and consider producing these types of videos for you. Thank you for your interest and attention, and I look forward to speaking with you again.